So I'm going to be performing your head to toe assessment today. We're going to make sure we have adequate lighting, the privacy curtain is closed. I'm going to do some hand hygiene, put some gloves on. Can you state your name and your date of birth for me?
Daria Goen, 11/24/2000.
All right, if you have any questions or if you feel any pain during this assessment, just let me know.
Okay.
So I'm going to start with your hands. Just going to inspect them. I note some redness on your knuckles. Is that normal?
Yep.
All right, some scratches.
Yep, from my cat.
From your cat, okay. Turn your hands over. All right, your hands are smooth, they're dry, they're intact, they're warm. I'm gonna move into your nail bed. Your nails are cleaned, well groomed. I'm gonna do your capillary refill. It's less than 3 seconds. And I'm gonna press on your joints. If you feel any pain, let me know.
Mm-hmm.
Noting any pain?
Nope.
All right, so your hands are intact, no abnormalities or lesions. So I'm gonna move into your face. Just noting that you have some acne, some redness. Your skin is smooth and dry. It's intact. Is there any pain? All right, so I'm gonna move into your head now. I'm gonna palpate for any like lesions, infestations, or abnormal masses.
Okay.
Just palpating. I'm not noticing any masses or any abnormalities, any lesions. Looking, there's no infestations. Your hair is brown, it's very fine. So I'm going to move into the cranial nerve 5 test. So I just want you to clench your jaw. And I'm going to feel your temporal artery and your mandibular joint. All right, is there any pain noted?
Mm-mm.
All right, and your cranial nerve 7. So I'm going to have you smile, I'm going to have you frown, I'm going to have you raise your eyebrows, close your eyes and don't open them against resistance. All right, good. And puff out your cheeks. And you're going to blow. So off of that, I'm going to palpate your sinuses. So we're going to do your frontal and your maxillary. Any pain,
Nope.
tenderness? All right, so I'm going to move into your eyes, okay? So first off, I'm just going to shine the light at them and look at them. All right, your sclera is white, your pupils are black, they're equal in size, your irises are brown, you have equal hair distribution on your eyebrows and your eyelashes. I'm gonna have you pull down your conjunctiva. All right, your conjunctiva is moist and pink.
Mm-hmm.
So I'm going to move into cranial nerve 2.
Okay.
So I'm gonna have you put your hand in between here. I'm just gonna look at your pupils and make sure that they're both constricting and accommodating to the light, which they are. So cranial nerve 2 is intact.
Okay.
I'm gonna have you. We're gonna move into the positions of cardinal gaze. So I'm gonna have you cover one eye. I'm gonna cover the same eye, and I'm just gonna put my hand, and you're gonna tell me the number when it comes into your range. Okay?
Okay.
Sorry, start that. Okay.
2. 2.
And the other eye.
2. 2. 2.
All right, good. We're gonna do the convergence test. So I'm just gonna have you follow my pen to your nose. All right, and there's no nystagmus or anything. And then you're also going to watch my positions. So you're gonna follow my pen going around. Okay.
Okay.
All right, good. And again, no nystagmus or eye slowness or anything. And so we did your peripheral vision, your cardinal positions of gaze, and your convergence test. So your eyes are perla, they're equal, responding, reactive to light, and accommodating. And your cranial nerves 2, 3, 4, and 6 are all intact.
Okay.
So off of that, we're going to move into your ears.
Okay.
So I'm just gonna move the hair behind your ears, and I'm gonna look at them. They're symmetrical. I note that you have piercings on both your lobes, some freckles. There's no buildup of earwax or any ear serum. So I'm going to palpate them, and
Okay.
I'm going to do your pinna and your tragus. Tell me if you feel any pain. Any pain?
Mm-mm.
All right. So I'm going to do a whisper test. So I'm going to repeat 3 words, and I want you to push on your tragus on the one I'm whispering and
Okay.
repeat the word, okay?
Yellow. Candy. Coffee. Yellow. Candy. Coffee.
All right, so cranial nerve 10 is intact. So, I'm sorry, cranial nerve 8 is intact. And we're going to move on to your nose. So I'm looking at your nose and it's symmetrical, it's even, I don't know any drainage or redness, probably a little bit of acne, but I'm gonna have you tilt your head back and I'm gonna look up it with the light. All right, so septum is midline. I don't know any deviation, any abnormal drainage. Are you having any pain in your nose? All right, so we're gonna test the patency of your nostrils. So I want you to close one and breathe in and out. And the other one. All right, good patency. So we're gonna move on into your mouth region. So I'm gonna look at your lips and I know that they're a little dry. They're pink, so I'm gonna have you open your mouth and smile. All right, your teeth are round. Your gums are around each. They're white. So I'm gonna have you open your mouth and you can stick out your tongue. All right, your tongue is pink and moist. Your tonsils are a grade 2. Your uvula is midline. I'm gonna look at your hard palate. It's moist, and your soft palate. It's moist and pink and no deviations. You can move your tongue to the side for me. All right, and the other side. And you can pull your lip down. All right, and your buccal mucosa is pink and moist, which I expected. So we're gonna move into cranial nerve 10 test.
Okay.
So this is where you're gonna say ah, ah, ah for me with your tongue out. All right, good. And your uvula is moving. So cranial nerve 10 is intact. So we're going to move into, well, do you have a gag reflex?
Yeah.
So your cranial nerve 9 is intact. So we're going to do cranial nerve 12. So you're going to say light, tight, and dynamite for me.
Okay. Light.
With your tongue out, sorry. Your tongue side to side.
Light, tight, dynamite.
All right, good. So your TD and N pronunciations are all there. So cranial nerve 12 is intact. So off of that, we are going to move into your neck.
Okay.
So I'm going to be inspecting your neck, and I'm just looking for any discoloration, any large masses, any abnormal pulsations, and it all looks, I don't know any of those. So I'm going to palpate your neck, noting any pain or tenderness.
No.
No, okay. So I'm going to palpate your trachea. Your trachea is midline. Are you having any pain? All right. And then I'm going to do your thyroid glands. Okay, I'm going to palpate your thyroid glands. Are you noting any pain or tenderness? And they're non-palpable, so that's good. So I'm going to do the swallow test with you. So I want you to turn to the side.
Okay.
All right, and the other side. All right, and then your trachea is moving up and down, so it is healthy. Or not healthy, it's intact. There's no abnormalities. All right, so now I am going to do your carotids. So, just doing this. Okay, and there's even strength, they're healthy. There's no abnormalities. I'm also going to test for a bruit with my bell. All right, and no bruit detected. So we're going to move into skin turgor. Okay, so I'm just gonna pinch an area of skin on your clavicle, and there's no tenting, so there's no turgor. All right, so I'm just gonna grab this, and we can move into your lymph nodes. Okay.
Okay.
So I'm just gonna start palpating them by doing your preocular, your postocular, your occipital, your submandibular, your tonsillar, your superior cervical, your deep chain cervical, and your posterior cervical, and your clavicular. Then I'm gonna go into your submental for the last one.
Okay.
Are you noting any pain?
Nope.
All right. So I am going to do some range of motion with you for your neck.
Okay.
So I'm gonna have you lift your neck up, down, into your shoulder, into your other shoulder, and shrug your shoulders. All right. Any pain?
Nope.
All right. Shrug your shoulders, and move your hand or your head against my hand. Good. All right. And you can do it with resistance, and there is no pain, so your range of motion in your neck is all intact.
Okay.
So I'm going to have you come over to the bed.
Okay.
Since your range of motion is all adequate, that means that cranial nerve 11 is adequate, and we're going to move on to your back part of your inspection. Okay. So just noting that your AP to transverse ratio is 1 to 2. There's no barrel chest. just gonna start palpating for any masses or pain or tenderness. Okay.
Okay.
Just palpate down. Are you noting any pain or tenderness?
No.
All right. So I'm gonna go to your spinous process. Just palpate down. It's all symmetrical. There's no hard masses or large masses in your back. Spine is straight. So this is my note card. So I'm just inspecting the skin at the same time that I'm doing that. So I see a mole and I see a little bit of acne that looks like it's gone away, or for the most part, a little skin color discoloration right there. So I'm going to go into your spinous, I just did your spinous process, your tactile firmitus. So I just want you to say 99 for me.
99, 99, 99, 99.
Okay, good. And now your chest expansion at your 10th intercostal. Just breathe in, out. All right, and symmetrical, bilaterally equal chest expansion. So from there we can percuss. We're looking for areas of resonance and all. Alright, and low pitch, so I'm hearing. Alright, so off the percussion, I can move into CVA tenderness. So I'm going to go right here around the 12th intercostal, and I'm just going to indirect blunt. Any tenderness?
Nope.
Alright. So I'm going to auscultate the lung sounds and just take deep breaths for me, okay? Alright, and no advantageous sounds. So I'm actually going to have you move to the front for me now. Alright, we're going to do this all over again. No, you're good. You just move your hair out. Okay, I'm just inspecting. I notice I have some freckles, some discoloration. I'm going to feel, and it's all warm. I'm going to palpate for any tenderness masses. Alright, and I feel no enlargements or no masses. I notice that you're not using any accessory muscles for breathing. Your respirations are unlabored.
Okay.
They're all intact. So I'm going to percuss those same areas again. Areas of resonance and under the jaw. Alright. So I'm going to move into auscultation. I'm not going to move into auscultation. I'm going to move into tactile firmitus on your chest again. So just say 99 for me.
99, 99, 99, 99.
Alright, good. All equally bilateral. Okay. So we're going to auscultate your lung sounds again from the front. So just take deep breaths for me. If you need a break, let me know. Alright, and again, no advantageous sounds. Any pain?
Nope.
Alright, so we're going to move into your upper extremities. So I'm just going to start off by inspecting them and note that your skin is dry and smooth. A little cold in here, got a little goosebumps.
Yep, you're freezing.
I'm going to palpate. You have even muscle tone. Do you have any pain?
Mm-mm.
Alright, I'm going to feel your subtrocular nodes. Alright. Okay, so off of that, we're going to do some range of motion. Okay. So first off, I'm going to have you stick your arms out and do flexion and extension. And against resistance, I'm going to have you do that.
Okay,
Yeah,
start
do it
this
again.
one over.
Right here. Yes.
There we go.
There we go. Okay. I'm going to have you lift your hands up and down and behind your back and to your head. And then I'm going to have you do your hands and your wrists. So wrists, move them. Alright, I'm going to have you hyperextend your fingers. I'm going to have you spread your fingers, make fist, and squeeze mine. Wow, okay. Any pain?
No.
Okay, so your range of motion in your upper extremities are all intact and your nodes are non-palpable. So we are going to move into your JVD inspection. So I'm going to have you lay down.
Okay.
At a 30-degree angle. I'm just going to take my pen light. Okay. Yep. So move to the side. Just inspecting for JVD and any extra pulsations that I'm not seeing, so you can turn your head to the other way. And yes, no JVD is present. So off of JVD, we're going to move in to inspecting your chest again.
Okay.
So just inspecting for any abnormal pulsations, throws or heaves. Not noting any extra pulsations. So off of this, I am going to then again go to your apical pulse, which is in your fifth intercostal, and I'm going to feel it.
Okay.
And I should listen to it for a minute. I'm
Mm-hmm.
gonna take my. Go to the bell. All right, and it's steady and strong. +2 amplitude, same as your carotid.
Okay.
There's no abnormalities. Off of that, I am going to move into your heart sounds.
Okay.
So I'm going to be using my diaphragm to listen to your heart sounds. I'm going to be going into a Z motion. I'm going to be starting with your aortic, moving to your pulmonic, your herbs, your tricuspid, and your mitral.
Okay.
All right, and then I'm going to do the same thing with the bell in the same motion. I'm going to be testing for murmurs. All right, and no murmurs. Your heart sounds are all intact. So I heard S1 and S2. So off of that, we can move into your abdomen now. Okay, so first off, I'm going to start with inspecting it. And that your belly button is midline. I am not seeing any masses. You're flat, and your contour is flat and scaphoid. It's not distended. So I'm going to now auscultate your abdomen, and yes. So for normal sounds, I'm going to listen for around 3 minutes, and then for abnormal sounds, I'm going to be listening up to 5. So I'm going to start with your right upper quadrant, down to your right lower quadrant, your left upper quadrant, and your left lower quadrant. All right, so some gurgling is present. It's normal active. We're going to test now. I'm going to palpate and actually no, I'm not going to palpate. I'm going to do your aortic and your renal pulses first. So I'm going to make sure that I'm doing them right. Okay. So I'm going to be testing for bruits. Okay. And no bruits are heard. Alright, so we're going to move into a palpation, and it's going to be a light palpation up to 1.5 centimeters.
Okay.
Just going to look for any large masses, any distended organs, any pain. Alright, so off of your abdomen, I'm going to be moving into your femoral, your inguinal. So your femoral pulse is going to be located in your thigh, and I'm not going to go down, but it should be strong. It should be +2 amplitude. It should be steady and even, and then your inguinal is going to be located much deeper into your groin, and it should be the same thing.
Okay.
So off of those two, I'm going to be moving into your lower extremities. So you can lay your feet, flat out for me. So I'm just going to inspect them. I noticed some like scarring down here, some redness. Your legs are equal though. They're warm. There's no edema. Do you have any pain in your legs?
Nope.
Okay, smooth and intact. So I'm gonna move down to your feet. Sorry, my hands are cold. Your feet are smooth and dry and intact. A little redness down here. You have a little scratch. I assume it's from your cat again, like your wrist. Okay. Any pain in your toe joints?
Nope.
All right, we're gonna do your capillary refill, and it's less than 3 seconds. So yes, your feet are intact. So we're gonna move into the range of motion. So I'm just gonna have you lift your right leg up for me.
Okay.
Bring it to your chest. And I'm gonna have you bring it in and bring it out. Bring it down, away from your body and towards your body. All right, and now same thing with the other leg. Up to your chest, in, out, down, and away from your body and towards your body. All right, you noting any pain with those?
Nope.
All right, so after that, I'm gonna have you scoot to the end of the bed and sit. So now we're gonna do your other lower extremity range of motion with your knees and your ankles.
Okay.
So I'm gonna have you flex your legs out, extend them back in, and then against resistance. And in. All right, good. With your ankles, I'm gonna have you point them up, point them down. I'm gonna have you go inversion and eversion. All right, and now against resistance, up and down, inversion and eversion. Are you noting any pain?
Nope.
All right. So your range of motion in your hips is good, and your range of motion in your knee and your ankles are good. So off of that, we're gonna move into your sensations.
Okay.
So first off, I'm gonna start with this cotton ball. As you can see, it is soft, right? So I'm gonna put it around your face, and I want you to tell me when you feel the sensation. Okay.
Okay.
So you can close your eyes and just say now.
No. 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 No.
All right, good. So now we're gonna introduce. Gotta find my objects. And yep, introduce two more. So we have soft, we have dull, and we have sharp. Okay. So I'm gonna put this around your body, and you're gonna tell me what you feel.
Okay.
So I'm gonna have you close your eyes.
Soft. Sharp. Dull. Soft. Sharp. Dull. Soft. Sharp. Dull. Sharp. Soft. Sharp. Soft. Dull. Soft. Dull. Soft. Sharp. Sharp.
Okay, good. So your sensations are met, and especially in your face. So cranial nerve 5 is intact.
Okay.
So off of that, we're going to move into. We're gonna do sternocys first. So I'm gonna have you close your eyes. I'm gonna put an object in your hand. I want you to tell me what the object is. Okay.
Okay. Sucker. Chapstick. Cotton ball.
All right. Good. So now we're gonna do your position sense. So I'm
Okay.
gonna have you stick your hands out, close your eyes, and you're gonna tell me whether I'm putting your finger up or down. Okay.
Up. Down. Up. Down. Up. Up.
Okay. Good. So, that was with your position sense. So, and your sternocys, which you passed. So we're gonna move into your cerebral function. So your cerebral function is gonna include 2 tests. The first one I'm gonna have you do is do your heel to your shin on both. All right, good. And your second one is I'm gonna have you touch your finger or touch your nose and then touch my finger. Okay. I'm gonna be moving it. All right. That's okay. We'll do that. Okay. So again, no miscoordination. Your coordination is good.
Okay.
You're able to follow. So I'm going to move into your reflexes. Now I
Okay.
don't have a hammer, but I'm just going to say the triceps is right here. I would have her relax her arm, and I would hit here, and she should have some flexion on both sides. And then we would do a patellar, where I would strike here, and we should expect flexion of her lower extremities. And then the last test, which we can do, is the Babinski reflex, where I run this up your foot. Oops. And she's ticklish, so the toes should not flare, but they didn't spread out, so still a negative test of Babinski, which is good. So after your reflexes, we're going to move into the Romberg test. So I'm going to have you stand up. I'm going to have you just stand still, okay?
Okay.
And now close your eyes. And open them. And there's no swaying, so we have a negative test for Romberg. So after our Romberg test, we are going to be moving into our walking. So I'm just going to have you walk to me. I'm going to have you walk back, heel to toe. I'm going to have you go on your tiptoes back. And your heels on the way back. And then I'm going to have you do a slight bend in the knee on the way back. Slight bend in the knee. Yes.
Okay.
All right, good. So off of that, I'm going to have you stand right in front of me.
Okay.
And I'm going to have you bend down and touch your toes. Okay. So your spine is straight, it's even, your hips are both symmetrical. Are you having any pain when you're down there?
Nope.
All right, so we're gonna move into spine range of motion.
Okay.
So I'm gonna have you just lean to a side, and I twist, and move back. All right, experiencing any pain?
Nope.
All right, so your range of motion and your spine is good. You're walking, you're coordinated, your hand is moving opposite a leg. You experience no pain. So this will conclude my test, and I thank you for being my participant.
Okay.
And now I'm going to show my card to the camera. And now we're done.